Hi, I looked at the camera. It's like, whoa. So my research focuses on substance use and abuse across the lifespan. I'm really interested in why people begin smoking in the first place, and then in smokers who are currently trying to quit, how can we help them in their cessation attempts? I'm really interested in cigarette smoking during adolescence. This is a time when we see that substance use in general, but cigarette smoking specifically, is mostly initiated. So if you ask any adult smoker when they started smoking, it's usually during adolescence between the ages of 14 to 16. Substance use, like many behaviors, is driven by lots of different things. I'm really interested in taking that broad focus, looking at the individual factors that might be leading to substance use, how they interact with one another, and how they change over time in order to understand why people engage in substance use in the first place, and what it is that's making it difficult for them to quit, even when they're motivated to do so. And so the reason I'm really interested in communication science, and the reason that's kind of my home now, is because one of the biggest tools that I use in my day-to-day research is a mobile phone. So many people have mobile phones these days, they're with them all the time, and this makes it very easy to get lots of data on individual people as they go about their daily lives. So we can ask people about their depressed states, their anxiety, their sleep last night, and we don't even have to ask them questions. We get a lot of passive data from the way they're just interacting with their phones on a day-to-day basis. And so out of these smartphone data streams, we get a lot of information on what's changing, when it's changing, and how it's impacting our behaviors of interest. So in terms of teaching, I think about the great mentorship that I've had throughout my career, and the kind of biggest takeaway that I've had from that in the positions where I feel like I've been able to flourish the most has been when I've been able to just chase my curiosity and go after questions that I find really interesting. And so in supporting students, that's what I try to do. I try to help them identify problems that really spark their interests and support them to be able to do that work. And when that happens, the kind of work tends to follow. And so that kind of is part of how I've set up my lab. So my lab is called the Addiction, Health, and Adolescence Lab, and the acronym is the AHA Lab. Part of that is because it's a great pun. But two, I want students to feel able to have an interest in addiction, health, and adolescence, but also be able to follow their AHA moments and to go after the questions that are of most interest to them. So after doing this type of work for a couple of years, I hope someone who is in this field could walk away knowing that they're always going to be learning. And I think the most important thing when you're dealing with a problem that you're trying to solve, whatever that problem is that you feel empowered to take tools that are out there that might not be applied to the problem that you're currently going after, but knowing that you could do something interesting with that. And so part of that is just being a lifelong learner. So there's a reason that I've gone from psychology to bioengineering and now communication. There's things that you can learn from each field to bring to bear on your problem of interest.